Hello, my name is Steven Aguilar. My topic is Bitot spot. Continue. Definition: conjunctival lesion with a rabbit appearance that is associated with the nutritional deficit of vitamin A. It is constituted by a reset in picture. Continue video.
This picture represents what is called Bitot spots, and there are a few things which you need to know about Bitot spots. Basically, what is it, why is it seen in liver disease, and how common it's an advanced stage of liver disease called cirrhosis. Now, Bitot spots is basically a triangular or oval gray or whitish plug which is seen on the temporal or the nasal side, more frequently on the temporal side, as you can see in the picture. It occurs on the bulbar conjunctiva, and it is due to uh, conjunctival cirrhosis, which happens as a consequence of vitamin A deficiency. Now, regarding the relation of Bitot spots with liver disease, it is believed to be due to malabsorption of vitamin A as a consequence of decreased fat content in the bile, and if present it is a sign of liver cell failure. However, we see it rare in cirrhosis among adults irrespective of any etiology, and it is more frequently seen in children with advanced liver disease. You can see more videos on signs of liver disease and other clinical videos in this channel.
Thank you. Uh, Continuing definition. Bitot spot interested the bulbar conjunctival at the level of interpalpebral space and are always bilateral. More often they are temporal only, less frequently nasal and temporal, and more rarely only nasal. They are most always very close to limbo. Its shape is oval along the horizontal axis, irregularly circular, less frequently triangular, and sometimes along parallel to the lower limbo. Continue video.
In this clinical video on Bitot spots, we will start with clinical and pathological definition. Then we will try to identify the spots in eye. We will review WHO grading of xerophthalmia, in which grade it fits, and finally a case along with its treatment. Bitot spots are small triangular white patches resembling dried foam on the outer and inner sides of the cornea. Foamy appearance of Bitot spots is due to gas production by Corynebacterium cirrhosis. Pathologically, Bitot spots are metaplasia of the conjunctival epithelium and tangles of keratin admixed with gas-forming bacteria. Corynebacterium cirrhosis is the culprit, giving the lesion its characteristic typical foamy appearance. Now let's start with our case. 4-year-old male child weighing 11 kg was brought by parents with complaint of muddy discoloration of both eyes for 1 month. Now let's see WHO grading of xerophthalmia. XN is night blindness. In fact, night blindness is the first symptom of vitamin A deficiency. X1 is divided into X1A and X1B. X1A is conjunctival cirrhosis, and when conjunctival cirrhosis is associated with Bitot spot, it is X1B. X2 is corneal cirrhosis. X3 is divided into X3A and X3B. When corneal ulceration involvement is less than 1/3, it is X3A, and when corneal ulceration involves more than 1/3 of cornea, it is X3B. XS is corneal scarring, and XF is xerophthalmic fundus. Now let's see treatment in our case. It should be remembered that any stage of xerophthalmia should be treated with 60 mg of vitamin A. Same dose is repeated next day and after 14 days. In patients 6 to 11 months of age, doses should be reduced to half.
Continue. Pros and cons. Often this is the only present sign of where some children have had night blindness before. Bitot spots do not cause symptoms. Children are comfortable and the rest of the age light is normal. The conjugal and the cornea are moist and clear. There is no evidence of general malnutrition, but there are recurrent episodes of diarrhea. Continue video.
Well friends, here have a look at the conjunctiva over the sclera. You can see a triangular area which is actually the deposition of keratin in the conjunctival layer. So this is actually a known as Bitot spot. It can deposit in the form of triangular area or the oval area. This candidate came to us with the complaint of blindness during the night time as well as during the evening hours. So this Bitot spot is usually takes place due to the deficiency of vitamin A.
Okay, continue. Conclusion. Preparation is essential to restore case of blindness, and this associated with the defeat. The system and prior administration of the dose of vitamin E during the first year of life is a method that has been shown to be simple long cost and high benefit in the short term. Other measures of prevention in the medium and long term are the fortification of habitual food, like the sugar, programs of nutritional education, of the promotion of the summit cross of the table. Continue a video.
At times, symptoms become evident by our habits, as in our case, where child's symptom became evident by parents' habit of applying kajal. So let's start with our case and we will discuss things simultaneously. 7-year-old male child weighing 22.3 kilos presented with complaint of black spots in eyes for 14 days. On examination, you are seeing small triangular blackish patch on outer side of cornea resembling dried foam. Also see how beautifully kajal is applied on upper and lower eyelid by this child. Same findings are present in the right eye also, as you are seeing here. These triangular patches are of conjunctival xerosis and their foamy character is due to gas production by Corynebacterium xerosis present in horny epithelium. So it's a case of conjunctival xerosis became evident by parents' habit of applying kajal. So one may ask, what is xerosis? A xerosis is basically a dry, lusterless condition of conjunctiva due to a deficiency of mucin, which either occur as a sequel of a local ocular affection or in association with general disease like in our case, which is secondary to vitamin A deficiency. So our case is fitting in X1A
Okay.
grade.
Thank you.